Hello everyone, this is Saad Abdul Jabbar, Class 575 Current Events in Healthcare. This is the seventh current event. Uh, it's about the COVID-19 pandemic and the growth and usage of telemedicine or telehealth. In this presentation, I will start with a background about the telehealth. Then I will talk about the three components of telemedicine. Following, I will discuss some of the benefits and possible uses of telehealth, telemedicine. Then, four strategies to improve the adoption of telemedicine. And of course, as there are benefits of telemedicine, there are some drawbacks that I will also talk about. And then a conclusion of the whole topic. Background. So before going to the history of telemedicine and telehealth, what is telemedicine and what is telehealth? And what are the differences between the two? Telemedicine is the process of assessing, diagnosing, and treating patients from a distance through telecommunications technologies, which refers to remote clinical services or services without in-person visits. Telemedicine used for follow-up visits, management of chronic conditions, medication management, and such by a secure video call or an audio call too. Where telehealth includes a broad range of technologies and services to provide patients or patient care and improve the healthcare delivery system as a whole. So basically, telehealth can refer to remote, non-clinical services, and these include provide like healthcare providers training, administrative meetings, and continuing medical education, plus the clinical services as in telemedicine. The telemedicine started in the 1950s as a way to find a way to share information and images by telephone. The beginning of telemedicine was used mostly also to connect doctors working with a patient in one location to specialists somewhere else. And this is considered a great benefit, especially for rural areas or hard to reach populations where they lack primary care physicians or specialists and they are not readily available there. And over the last decade, telemedicine strategy has undergone a remarkable progression and development. Components of using telehealth. As we live in an era of constant digital communication, whereby just clicking on a button we can share insight, collaborate with people, and many other stuff that we can do. We have three types of using the telehealth in healthcare. Uh, the first one is the synchronous, and this is a live telephone or any audio or video call, typically with a patient using a phone, tablet, or a computer. In some cases, peripheral medical equipment like digital stethoscopes, otoscopes, ultrasounds can be used by another healthcare practitioner like a nurse or a medical assistant while consulting medical provider conducting a remote evaluation. And then we have asynchronous, which is like patients portals where information such as images and messages can be stored and then forwarded or responded to later in another time, which is usually help with the communication between a healthcare provider and patient through these secure portals. So basically, the difference between synchronous and asynchronous or synchronous communication happen in real time, again as live chat, video, or voice call, while asynchronous happen over a longer period of time, such as in recording or pre-recorded video or audio message or also an email. And of course, each has its own advantages and disadvantages. Where synchronous is great because it is fast and has active participation, but there might be interruptions or distraction depending on the time the call was going on. Where asynchronous, there is no need for scheduling, or if the internet connection was bad too, uh, or also if the patient and the provider are in different time zones, the patient or the provider can record a video or a call or again an email to send it to the patient and vice versa. And last one, we have the remote patient monitoring, which allows direct transmission of patients' clinical measurements from distance, where it could be live, and it also can be recorded too to their healthcare providers, where doctors can order remote patient monitoring equipment to be delivered to patients so they can track their vitals at home. Benefits and potential uses of telehealth. One of the most important aspects of using telehealth services, especially right now, is increasing the social distancing measures to reduce the infectious diseases in general. And the list we have here are some of these benefits and potential uses of telehealth, such as screening patients who may have symptoms of COVID-19 and refer them as possible. Also, we have providing low-risk urgent care for non-COVID-19 patients or conditions, identifying certain people who may require more medical treatment or diagnosis and refer them as also needed. Then we have providing guidance and assistance to people managing their chronic health problems, including weight loss and diet consulting. And we also have tracking medical symptoms of chronic medical problems, also such as blood pressure, blood glucose, and other remote assessments, as we discussed in the previous slide. Then we have case management, involvement with patients who have trouble receiving treatments, and those who live in very rural settings, older adults, and those with limited mobility. And also we have following up with patients after their hospitalization, and providing education and training for healthcare practitioners by peer-to-peer expert medical consultations, especially also for those ones that are not available locally, like in rural areas, and many, many more too. Strategies to improve the adoption of telehealth. The use of telehealth have shown many benefits, like what I was just talking about in the previous slides. But in order to increase the adoption and the use of telehealth and telemedicine, we can do that by encouraging and improving the use of telehealth services for the safety that it have shown for both of healthcare practitioners and safety of patients, especially when determining when in-person care is appropriate too. And then we have communication with insurers or payers to understand the availability of covered telehealth or telemedicine or nurse advice line services. And using teletriage methods or the screening of patients remotely for assessing and caring for all patients to decrease the volume of persons seeking care in these hospitals, especially during times like this of the COVID-19 pandemic. And also providing more expansion to patients with limited technology and connectivity, and offer flexibility in these programs that can be used for calls, video calls, or audio calls sessions, or non-video calls or emails options when possible. New York University Langone Health and New York University School of Medicine made a research about the use of telehealth where it showed the telemedicine has increased in the recent years, accounting for 8% of Americans accessing telehealth in 2019. The pandemic presented an urgent need to shift patients from inpatient care to prevent overcapacity flooding of emergency rooms and the risk also of getting the disease to have virtual visits and virtual care. The latest use of telehealth is not new to New York University Langone, where they send their front lines to various locations away from the hospital, where they rapidly adopted digital health to support more patients. The study they have done the result of it based on the pandemic. All the visits related to COVID-19, they use the diagnostic codes that reflect the symptoms of the infection, such as having a fever, the shortness of breath, cough, and other symptoms. Where the investigations over they made over a span of 6 weeks have reported 144,940 video visits that were performed by 115,789 individual patients and 2,656 different healthcare providers. And for all these online visits, 56% of the emergency and 17% of non-emergency visits, all of these were due to COVID-19 or related to the COVID-19. The surge in emergency telemedicine care has been made possible by a dramatic increase in emergency care providers, with a group of 40 emergency medical services who managed fewer than 100 visits on a single day. That increased to 289 visits, which is more than the double. The Langone Health extended also the video visits to all of its outpatient care facilities, reaching more than 7,000 visits in 10 days and accounting for more than 70% of overall outpatient services that was in this period of time. Also, the use of telemedicine was higher for patients between the ages of 20 and 44 years, in particular for emergency treatment. However, patients of all different ages too were able to use the technology through the New York University Langone Telemedicine Network. And another founding, they have found that the satisfaction rates of patients with telemedicine visits were positive, considering also the significant extension of the services to a lot of patients and for also additional providers they had. These were the foundings of the research done by both the NYC University Langoon and the NYC School of Medicine. And what they did actually also, healthcare providers can see COVID-19 patients remotely at the hospital in ICUs with tablets that help to save both personal protective equipment and also reduce the patient exposure to the virus. Knowing that the use of medical digital companions also help providers to engage with each other through digital health technologies. The NYU Langone Health and NYU Grossman School of Medicine have also received awards from the Federal Communications Commission's COVID-19 telehealth program to further their extended the scope of telemedicine systems, both within the hospital and through online patient care and other technology. Possible drawback of telehealth and telemedicine. So, as there are many advantages to telehealth, there are some disadvantages too, and this could or might actually change in the future. But there will always be two sides of accepting and using new technologies like that. So here we have some of the possible drawbacks here, like the licensing issues, where federal licensing issues and other compliance matters that can be different from a state to another state. Also, we have in-person visits could be a better option, where sometimes, depending on the situation, of course, it is hard to perform an accurate physical exam remotely, where in-person visit would be easier, the whole situation, and make everything faster too. And also we have sensitive topics or privacy, where for some people the privacy could be an issue for them if it was not in person in a hospital, like in a room with just them and the healthcare practitioner, where not all patients could have this kind of privacy at home or anywhere else other than the hospital. Then we have limited access to technology, where limited access to technological devices, for example, smartphones, tablets, computers, and any technological device like that needed for the telehealth visit, or any connectivity issues, internet issues, and so on. Then we have the level of comfort with technology for either healthcare practitioners or patients too, where some people do not like using technology. And lastly, we have cultural acceptance of conducting virtual visits in lieu of in-person visits by healthcare practitioners and patients. In the end, with the help of telemedicine and telehealth, patients can receive the proper care they seek remotely. The quality and the easiness the technologies have provided us in the healthcare sector made a huge positive impact fighting especially the COVID-19, and prepared the healthcare system for future infectious diseases or any other diseases too. Now, across the country, many healthcare sectors are embracing telemedicine to provide convenient patient care and drive strong financial results to their practice. According to IBIS World, the industry revenue has grown 35% from 2014 with $500 million to 2019 with almost $2.5 billion dollars, where the market size is also projected to grow more in the coming years for a lot more than the double what it is right now. According to a 2017 study, in America, 82% did not use telemedicine, and that was before the COVID-19 pandemic. But now the number increased dramatically from almost 11,000 a week to more than 660,000 people in a week. This pandemic created a clear line between the before and after for the wider healthcare industry, and telemedicine might be a big part of what we will have after the COVID-19. Hoping for a better health care system, of course. And that's it for today's presentation, and thank you so much for listening.